Welcome back, guys. Dr. Joe Sullivan with Haven Chiropractic and Sports Medicine, located in Palmer, Alaska. Today we're going to be going over an exercise called a 90-90 hip shift with an external and internal rotation lift-off. To perform this exercise, it's really great for hip mobility as well as tightness that we can sometimes feel in low back, lateral hips, and even in through the groin as well. Starting this exercise, we're in a seated position. We're going to have our legs a little bit wider than our hips, knees at 90 degrees. We're going to be pulling our toes up during this exercise as well, so we can use our heels to pivot around. Leaning backwards, you can support the weight of your body with your hands. During this exercise, we want to try to keep both glutes flat on the ground so we're not leaning too far over to one side. To start this movement, we're going to be dropping one leg down towards the ground while also leading the other knee as well. Again, not trying to roll too much. That movement then comes from the low back and the body as opposed from just to isolating our hips. Let those knees drop down, spend 2 to 3 seconds in that position, rotate over to the other side, 2 to 3 seconds in that position as well. When performing this exercise, it's easy to set a timer on your phone for a minute and go through both positions, 2 to 3 second holds, rotating over, again, keeping our toes pulled up, using our heels to pivot around. After that minute is complete, we come over to one hip in that bad position that I mentioned earlier, but for this, we're just going to be isolating that motion on my right hip. For here, the first movement is we're going to be working the external rotation of our leg, so trying to lift that right leg into that external movement, and then back down. This stretch, as we go deeper, feels more groin and adductors, sometimes front hip tightness. Rotating out, 10 reps of that movement. Then we shift our weight over our left leg or our down leg. In this position, we're going to be keeping our knee down on the ground, and we're going to be lifting our leg up off, or our foot up. So internal rotation, lift off with this. Again, trying to just let that movement come from the hip. Sometimes a cramping sensation can happen on the outside of your hip. That is supposed to happen. It's working those deep internal hip rotators. It's helping our brain get connected to those muscles and find the tolerance of that movement. So work through that as much as tolerable. 10 reps of that movement, and then we go over to the other side and work that same external rotation with my left leg. Trying to go a little bit deeper every time into that stretch. Come over the other leg, keeping knee down, lifting that ankle complex off the floor. Again, that's a 90-90 hip shift with internal and external rotation liftoffs. Again, I'm Dr. Joe Sullivan with Haven Chiropractic and Sports Medicine.